In March 2020, the U.S. faced an unprecedented challenge with the declaration of the COVID-19 pandemic. State procurement offices immediately responded.
Procurement is complex in the best of times. Throw in a pandemic, shelter-in-place directives, and the need to completely overhaul our processes in response. The questions and issues were endless and crucial.
Connecticut was one of the hardest hit states in the country, and most staff immediately knew individuals impacted. Multiple colleagues were hospitalized and fighting for their lives. This wasn't just a hypothetical exercise. We were doing this for our colleagues, our families, and our neighbors.
I can proudly say that being a procurement professional for over 35 years, this was the most memorable and important professional challenge that I have ever faced.
Procurement was immediately able to adapt to rapidly changing needs and circumstances to assist.
It became clear early in this pandemic that our normal processes, as excellent and structured as they are, were not going to fit the times as the supply chain broke down.
It became clear to us that we need a very focused team to respond to the myriad inquiries we started to receive basically on an hourly basis.
When leadership asked if I was willing to work weekends and unusual hours, I got excited and asked, where can I sign up?
It's been an eye-opening experience to figure out what all this PPE is and how to source it and get it in the hands of the people who need it.
One of the biggest challenges was understanding PPE specifications established by the FDA and the CDC. The transportation team, who typically buys roadway material including asphalt, concrete, and road salt, faced a steep learning curve when they became the primary purchasers of the N95 and 3-ply medical masks.
The main challenge we found was that there was no definitive stopping point regarding the quantity of PPE items needed. In other words, how much is enough?
The state of Michigan procurement became the product lead for setting up the state's first field hospital. It was a big job with a tight deadline. We worked around the clock with a single goal in mind: get this hospital set up and fight the pandemic.
The teams needed to set up and stock emergency patient overflow care facilities across the Commonwealth, develop processes and procedures, and provide training on the emergency process. We worked with our oversight authority to execute blanket rule exceptions to facilitate email solicitation submissions. We quickly established a vetting process that weeded out inadequate vendors and identified those who could meet our needs with reasonable and transparent pricing.
We partnered with others to really capitalize on the manufacturing network already existing within our state. Our willingness to search out these less than typical arrangements helped us engage Michiganders in protecting their own state while fulfilling our critical needs.
As a result of our order, we have hired furloughed workers, doubling our pre-COVID workforce. We are serving Native American tribes, nursing homes, homeless shelters, and lots of small dental, optometry, and pediatric offices who could not get PPE from typical sources.
Whatever is needed to get the job done, they do it with a high level of professionalism and team collaboration. Through every challenging project, each and every member of the team has stepped outside of their normal job responsibilities to ensure that their customers' needs are met.
Thanks to each and every one of you sourcing this, making sure that everybody had the mask and the gown and the protection they needed. I know how tough it was, I know how stressful it was, and I know how well you did it. Thank you.
I am so grateful for the partnership network that we've been working with through both established partners as well as new partners that stepped forward to collaborate on the response here in Ohio. We were all in this together.
With a relentless commitment to excellence, your work saved lives.